Hospitals and healthcare workers are once again overwhelmed with the rising COVID cases. We now speak to Dr. Oscar Tinio. He's a past president and now the spokesperson of the Philippine Medical Association. Good morning, Dr. Tinio. Thanks for being with us today. Now, how alarming is this surge in cases to our country's healthcare system? And we've been through this last year, Dr. Tinio, but is our healthcare system ready for another surge like this?
Good morning, Mike. Thanks for having me. You know, we are very alarmed and we are very concerned about what is going on right now insofar as the rising number of cases in the country is concerned. And to answer your question about the hospitals being overwhelmed, well, yes, indeed, we have more cases right now. We have more admissions right now. And we even have doctors who are also infected at the moment. The good thing about this is we are now getting vaccinated as well. The local government units are now concerned about having the healthcare providers being given the vaccine. And we just had ours just a few days back.
Now, Dr. Tinio, oras na po ba to ask for a timeout? Kayo po sa Philippine Medical Association, do you think it's time to call for a stricter quarantine status?
You know, the real problem is, you know, we doctors don't go on a timeout. And it's just that I think what we should be more concerned about is the fact that kailangan lahat tayo, lahat ng mamamayan, lahat ng mga nandito po sa Metro Manila or even in the other parts of the country, kailangan isundin po natin strictly yung protocols natin for yung ating basic health protocols. Because no matter what variants are there, yun pa rin ang problema. If we allow ourselves to be infected, then nothing can stop the spread of the virus. No? But to tell you frankly, no, I think the cases are even, as far as I'm concerned, from experiences, the cases are still understated because you know, when we do test other people from for COVID, you know, we're getting test results like they had the infection before, but it never manifested or it never showed up. So I'm sure if we do more testing, if we'll find more cases and we'll be able to contact trace and find more people being sick of COVID but without any symptoms. Yung tungkol sa timeout, I think the doctors should be more vigilant. We should be more adept to what we're dealing with, and I would like to emphasize again, we should all observe strict health protocols.
Yes,
Wearing
vigilant.
face masks,
Not
face
just for the
shields.
doctors, Dr. Tinio, but also from all of us. We need to be extra careful. And now we're hearing a grim forecast from the health department. It said that cases could multiply 28 times more if the new variants become dominant. Now, aside from following the minimum health protocols, ano pa po ang pwede natin gawin to prevent us from reaching this level? How can we protect ourselves from these new variants, Doctor?
Well, alam nyo, like what I've said, yung variants, no matter what they are, if we're able to protect ourselves, then we probably can avoid it. Pero yung importante is for every patient, for every individual to know and to understand na pag meron silang nararamdaman, they should seek consultation. Dapat pumunta na sila sa mga doktor nila so that we can find a way to mitigate the case doon po sa level ng pasyente pa lamang, and then probably also do contact tracing. Importante po malaman natin kung sino-sino yung mga nakaharap niya, kung sino-sino po yung mga taong nasa paligid niya so that we can act immediately and of course try and halt the spread of the disease from that individual and from other individuals as well.
Right. Now, Doctor, patuloy pa rin pong nahawaan ng COVID-19 ang medical doctors and practitioners natin. How many doctors have been infected po with the virus, Doc? Do you have the figures?
Yeah, that's a very good question. Problem is we don't have the exact figures right now. We're still trying to find out kung sino-sino at gaano kadami sa aming mga manggagamot ngayon ang nahawa. No? But the point is, I know of a few cases na very serious yung ating mga kasamahan. Like in Batangas, like in Metro Manila, marami po tayong mga kasama dyan na naka-self-quarantine na rin because they have been exposed. And we'll try and find the numbers when we probably if we ever we will be able to speak again. We'll give you a clear figure of as to the number of cases that we have among doctors and probably other healthcare providers as well.
Stay safe, Doc. I hope you all stay safe. Thank you, Dr. Oscar Tinio, spokesperson of the Philippine Medical Association.